Hypertension. What is hypertension? Definition. Hypertension, HTN, also known as high blood pressure, is defined as a persistent elevation in systemic arterial blood pressure. Diagnosis. Diagnosed when systolic blood pressure is consistently 130 mmHg or higher, or diastolic blood pressure is consistently 80 mmHg or higher. This guideline can vary by organization. Classification. Primary, essential. Hypertension, the most common type of HTN with no identifiable underlying cause, often thought to be multifactorial, resulting from a combination of genetics and environmental factors. Secondary hypertension, high blood pressure that is caused by an identifiable underlying medical condition. Pathophysiology of hypertension. Hypertension develops due to a complex interplay of factors including increased peripheral vascular resistance, PVR, arteriole constriction. Sustained vasoconstriction of arterioles increases SVR, leading to increased blood pressure, especially diastolic blood pressure. Endothelial dysfunction, damage to the endothelium lining. Blood vessels reduces vasodilation and promotes constriction. Neurohormonal factors. Overactivation of the sympathetic nervous system and the renin-angiotensin-aldosterone system, RAAS, increases vasoconstriction. Increased blood volume. Sodium and water retention. Kidneys' inability to properly excrete sodium and water, leading to an increase in blood volume. RAAS activation. Increased renin-angiotensin-aldosterone system, RAAS, activity leads to sodium and water retention. Hormones. Increased aldosterone levels can also increase sodium and water retention. Increased cardiac output, CO. Increased heart rate. Elevated heart rate can increase cardiac output. Increased stroke volume. Increased cardiac contractility and increased blood volume can increase stroke volume and therefore cardiac output. Structural changes in blood vessels. Arteriosclerosis, stiffening of blood vessels due to plaque formation and changes in collagen and elastin in the vessel wall. Reduced vascular compliance. Reduced ability of the blood vessels to expand and contract, leading to increased blood pressure. Genetics. Family history. A family history of HTN increases the risk. Genetic predisposition. Numerous genes have been linked to hypertension. Environmental factors. Diet. High sodium intake, low potassium intake, high fat intake, and diets lacking in fruits and vegetables can lead to hypertension. Obesity. Increased body weight can cause HTN by increasing cardiac output, blood volume, and RAS activity. Lack of exercise. Sedentary lifestyle contributes to increased blood pressure. Stress. Chronic stress contributes to an elevated sympathetic nervous system and increased blood pressure. Smoking. Smoking damages blood vessels, and it increases blood pressure. Excessive alcohol use. Excessive alcohol consumption can increase blood pressure. Age. Older age is a risk factor for hypertension. Risk factors for hypertension, non-modifiable risk factors. Age. Risk increases with age. Family history. Family history of hypertension increases risk. Race. African Americans have a higher risk of developing hypertension. Modifiable risk factors. Obesity, overweight. Sedentary lifestyle. High sodium intake, low potassium intake, smoking, excessive alcohol consumption, stress. Sleep apnea. Clinical manifestations of hypertension. Symptomatic. In its early stages, hypertension is often asymptomatic, silent killer. Headaches. Some patients with high blood pressure experience headaches. Dizziness and lightheadedness can occur, particularly with rapid changes in blood pressure. Vision changes can occur from damage to the blood vessels in the eyes. Nosebleeds. Increased frequency of nosebleeds. Chest pain may occur with severely elevated blood pressure. Long-term consequences of uncontrolled hypertension. Cardiovascular disease. Increased risk of heart attack, stroke, heart failure, and peripheral artery disease. Kidney disease. Nephropathy. Damage to the blood vessels of the kidneys can lead to chronic kidney disease. Eye disease. Retinopathy. Damage to the blood vessels in the retina can lead to vision loss. Cognitive dysfunction. Increased risk for cognitive decline and dementia. Peripheral artery disease, PAD. Narrowing of arteries in the limbs can lead to pain and decreased blood flow. Diagnosis of hypertension, blood pressure measurement, multiple readings. Requires multiple elevated blood pressure measurements over time on different occasions. Proper technique. Measurement must be taken using proper technique to avoid error. Ambulatory blood pressure. Monitoring. can be used to measure blood pressure levels over a 24-hour period. Home blood pressure monitoring, taking the blood pressure at home regularly. History and physical examination, to identify risk factors and underlying causes. Laboratory tests. Blood tests, to check lipid levels, glucose, electrolytes, and kidney function. Urinalysis, to check for protein or other abnormalities in the urine. ECG, to assess for heart problems that may be associated with hypertension. Echocardiogram, to assess heart structure and function. Management of hypertension, lifestyle modifications. Weight loss, if overweight or obese. Dietary changes, reduce sodium intake, increase potassium, consume a diet rich in fruits, vegetables, and whole grains, and follow the DASH diet. Regular exercise, at least 150 minutes of moderate intensity aerobic exercise per week. Smoking cessation, stop smoking. Limit alcohol consumption, limit alcohol intake. Stress management, implement strategies to manage stress. Pharmacological management, antihypertensive medications. Thiazide, diuretics, help the kidneys excrete sodium and water. ACE inhibitors, angiotensin-converting enzyme inhibitors, block the production of angiotensin II, reducing vasoconstriction and sodium retention. ARBs, angiotensin II receptor blockers, block the action of angiotensin II, reducing vasoconstriction and sodium retention. Beta blockers, slow heart rate and reduce blood pressure. Calcium channel blockers, block the influx of calcium into blood vessel smooth muscle, causing vasodilation. Alpha blockers, block alpha receptors, causing vasodilation. Direct renin inhibitors, inhibit the first step in the RAS system. Patient education and monitoring. Education, explain the condition, treatment, and importance of lifestyle changes. Monitoring, regular blood pressure monitoring is required, both in the clinic and at home. Dr. Hammer leans back, his tone now summarizing and serious. Okay, student, hypertension, a very common condition with very serious implications. You need to understand its complex pathophysiology, including its relationship with vascular resistance, blood volume, and the hormonal control of the system. You must be able to recognize its signs and symptoms to properly diagnose and to manage both the modifiable and non-modifiable risk factors. It's a silent killer, and you need to know how to manage it. Key takeaways. Hypertension is a common condition defined by persistently elevated blood pressure. It can be primary, essential, or secondary. Risk factors include genetics, diet, obesity, stress, and lack of exercise. It often has no symptoms, but over time, uncontrolled hypertension increases the risk of cardiovascular disease, kidney disease, and other complications. Diagnosis includes blood pressure measurement, blood tests, and evaluation for secondary causes. Management involves lifestyle modifications and medication.